Welcome to today's educational video. We'll be delving into the intricacies of a specific type of cataract, the cerulean cataract, also known as a blue dot cataract or congenital cataract. Join us as we explore its causes, symptoms, diagnosis, and treatment options, providing you with a comprehensive understanding of this unique condition. The etiology of cerulean cataracts is multifaceted. While some cases arise sporadically with no identifiable cause, the most common factor is genetics. These cataracts are often inherited in an autosomal dominant pattern, meaning that only one parent needs to carry the gene for the child to be affected. In other instances, they may be linked to chromosomal abnormalities or metabolic disorders. Certain medications taken during pregnancy or infections contracted by the mother can also, although rarely, contribute to the development of cerulean cataracts in the developing fetus. Pathophysiologically, cerulean cataracts are characterized by the presence of numerous small, bluish-white or bluish-gray opacities dispersed throughout the lens. These opacities primarily affect the lens cortex, the outer layer of the lens. They are composed of aggregated protein material. These protein aggregates scatter light, but since they are small and dispersed, the amount of scattering is often minimal, especially early in the disease. Over time, if these opacities increase in size or number, they can significantly impair vision by obstructing or distorting the passage of light to the retina. Epidemiologically, cerulean cataracts are relatively rare compared to age-related cataracts. They often present early in life, sometimes even at birth, classifying them as congenital cataracts. Because many cases are asymptomatic, determining the exact prevalence is challenging. However, studies suggest that congenital cataracts, as a whole, occur in approximately 1 to 6 per 10,000 newborns, with cerulean cataracts representing a subset of these cases. Due to the genetic component, they can be more prevalent in families with a history of the condition. The signs and symptoms of cerulean cataracts can vary considerably depending on the size, density, and location of the opacities. In many cases, especially when the opacities are small and sparse, individuals may be completely asymptomatic and the cataracts are only discovered during a routine eye examination. As the cataracts progress, individuals may experience decreased visual acuity, glare, halos around lights, or difficulty seeing in bright light. In children, uncorrected cerulean cataracts can lead to amblyopia, also known as lazy eye or nystagmus, involuntary eye movements, if left untreated. Diagnosis of cerulean cataracts typically involves a comprehensive eye examination performed by an ophthalmologist. This includes a visual acuity test to assess the patient's vision, a slit lamp examination to visualize the lens and identify the characteristic bluish opacities, and a dilated eye exam to evaluate the entire lens and rule out other potential causes of vision impairment. In children, a red reflex test is often used as an initial screening tool to detect the presence of cataracts. While cerulean cataracts don't fall into distinct subtypes, it's important to note the severity can vary greatly. Some individuals may have only a few small opacities that cause minimal visual disturbance, while others may have more extensive opacities that significantly impair vision. Therefore, management is tailored to the individual's specific needs and the impact on their daily life. The treatment and management of cerulean cataracts depend on the degree of visual impairment. If the cataracts are mild and do not significantly affect vision, observation and regular eye exams may be sufficient. If vision is impaired, glasses or contact lenses may provide some improvement. In cases where the cataracts are significantly affecting vision, surgery is often recommended. The surgical procedure involves removing the clouded lens and replacing it with an artificial intraocular lens, or IO. For children, timely surgical intervention is critical to prevent amblyopia and ensure proper visual development. Currently, there is no known way to completely prevent cerulean cataracts, especially those with a genetic component. However, individuals with a family history of cataracts should undergo regular eye examinations to detect the condition early. Pregnant women should receive adequate prenatal care and avoid potential risk factors, such as certain medications and infections, that could increase the risk of congenital cataracts. Genetic counseling may be beneficial for families with a history of inherited cataracts. The prognosis for individuals with cerulean cataracts is generally good, especially with early detection and appropriate management. Surgical intervention is highly effective in restoring vision. However, it's important to note that long-term monitoring is necessary to detect and manage any potential complications, such as posterior capsule opacification, which can occur after cataract surgery. Research continues to investigate the genetic causes and potential therapies for congenital cataracts, including cerulean cataracts, with the aim of improving outcomes and potentially preventing the development of these conditions in the future. One area of research focuses on gene therapy as a potential future treatment to correct the underlying genetic defects that cause some forms of congenital cataracts.